of it. Oh, can you pull the bottom? Chance? Sure. Pull it. Wait. Okay, now pull.
Here, I'm videotaping.
Let Daddy film. Could be upside down. What's it say? You're bigger than Vancouver. You're bigger than Venice. Dr. Pimple Popper, you're even bigger than Las Vegas. Well, it's reward enough, but we're incredibly proud of all you've done. So we hope that you'll accept this gold play button as a token of our esteem. What if it's a diamond play button by mistake? Ready?
It even has your logo. Wow. I can see myself in it.
That's awesome. What should we do with it? Should we use it like a splash mask?
No.
Splash some pimples on it?
No.
It's pretty heavy, huh? Here, wanna hold it? Don't drop it.
Well, it's way heavier when it's out of the box.
Yeah, it's very nice. It's very pretty. We gotta hang this in the office.
Why in the office?
Because that's where people will go see it.
Well, we're not here.
No one's gonna see it here.
I don't care.
That's pretty dang nice. Thank you, YouTube. How long do you think? He's in there, man. He wants to see. So we just use that to kind of loosen it up a little bit. And then I put that numbing there so she can't feel it. And then we're just gonna squeeze. There you go. Maybe you want to give him one of these for, I'm afraid though, what he'll do with it when you're home.
Oh,
see, it's
gosh.
a little bit, it's like a little tadpole. Here, let me show it to you, sweetie. See your little tadpole?
Oh, okay.
It's kind of cute, huh? It might fill up again, it might not, and hopefully it won't. You know, it's a little bit of a dilated pore right here, but it's a little one. Just keep, it might fill up, so it'll give you future days of joy and excitement, okay? There you go, done.
She said,
so much
you
about
walk around like that?
I didn't say, you know, oh, you remember everything I say.
do.
And
I
you know I'm not saying, you're making it sound like it's such a negative,
Is
what I'm
this
saying
video?
in such a mean way. Yes, it is.
Is it audio too?
It's audio too.
Good.
Do you want me to-
I got it.
Troublemaker.
Say
Got a big
what?
old whitehead right here. He's saying that I say mean things like I'm waiting for him
No.
to, I'm waiting
You
to
didn't
off
say it was
him.
mean.
Ooh, I was very, am I hurting you?
Maybe. I'm delicate. Sensitive.
It's all gone.
Good.
Troublemaker
Oh,
is you.
really?
Yes, I am. You gotta find someone to do this for you. Your daughter's not into pimple popping, huh? Well, that would be weird, I guess. If
You know,
she's...
that's why it's good there's you, Sandra.
Yes, right? I'm good for something.
You're great.
Oh, I'm sorry. See, there's a sigh. That's what he does. That's his thing. You know that it is your daughter is afraid of your sigh. You know when you sigh that you're mad or you're upset about something. That's it. Don't want it to distort us. How long have you noticed this for? How long have you noticed this here for?
Well, see, like I told you, I've had 3 surgeries, and anyway, just probably not more than a month or so that I noticed.
But you've been dealing with so many other things. That,
Yeah.
I'm sorry. Have you been doing okay with your surgeries? Or?
Yeah, thank you.
Just gonna make a little nick in it. Squeeze that out. Just was really sitting up there. It wasn't quite as exciting as we had hoped. Probably for you, that's okay though. Are you, am I hurting you?
No,
Okay, because I'm gonna push against you a little to try to work this out.
it doesn't want to come out.
Well, no, it does. I just want to make it in as small a hole as nick as possible. So I have to kind of push all sides to work it out.
The scars on my
Really?
abdomen, a little scar up there.
I know, but this you can see more, you know. My goodness, was this all like kind of like by surprise too? Oh my, all over your abdomen, huh? It's no good.
They took out 36 inches of intestine.
Oh,
and I had an ileostomy for 6 months, and
Oh, those are tough too.
then last month they reversed the ileostomy.
Okay.
So I'm doing good.
Good. I had a friend who had a ileostomy, had one too, and that's really quite a thing to go through.
Oh God,
Changes your life.
It's an emotional time.
Yes,
too.
it is.
Very,
It's very much a mental thing, I think.
Yeah.
Because people can't see it, but you feel like, I feel like she felt like I felt that everyone knew or something.
Right. That's what you feel like.
Why? Yeah, I wonder why that is. It just bothers you so much because it's such a normal thing we all take for granted, I guess, you know? Mm-hmm. So interesting, actually. But I'm glad you're doing well. Right. So we got this all. If this comes back, you let me know. But I think we worked it all out, and it just needs to take a little while to heal up here. Just don't want to push on you too much. Come on. All right. Okay. All right, do you want to put a little Band-Aid on there? You're okay.
Gonna say you do lipo.
Oh, yeah, right.
You do liposuction too.
Yeah, a little baby pinch here, okay? Just a baby pinch on you, pinch. Just like that. Now the trust I've got on him, I love it. If you feel anything, keep your eyes closed because there's numbing under here. I don't want it to trip into your eye. There you go. Okay, it's gonna make one little nick in the skin, so keep your eyes closed again. This is a little whitehead here. There we go. And then our little extractor here. This is her favorite part. That's my favorite. Yeah, it's a little bit more involved actually, I think. There we go. My hole wasn't that big. Wow, I think we just took off 10 years.
Yeah, dream on.
Hold on, we're not quite done yet. I think I need to make one more nick in there because it's still under there. You could take it off 10 years.
So you don't do plastic, you do liposuction.
I do, yeah. It's like cosmetic surgery, it is. Morning to you guys. Today I have my hat on and I got my splash mask that I'm going to put on. You guys are doing a lipo case this morning, so I'll snap my way through it, okay? Like a little numbing locally on the skin. You're doing great. Okay, just like a little thing like when we put like numbing in the skin if we're going to do a biopsy or something like that, alright? Bag with fluid and we have this, oh I got you. Gotcha, Christy. We're going to put this numbing right under the skin, okay? Okay. So we put a little numbing locally and then you, so what's interesting is when we numb the skin up, when we put a little local numbing on the surface of the skin, when I go under, you don't really feel anything. It's just really the surface of the skin that you feel. So when I'm putting the numbing in, I'm looking for something called tumescence, where you get this peau d'orange kind of look. Okay. This cannula is called a half monster. It has a lot of holes on the far edge, so I can infiltrate a lot more of the fluid at one time. So putting more infiltration in here, getting it really nice and tight. We want it to turn light like that. We want it to get this white color because that's when you know it's fully tumesced. Doing good, huh? Okay. So here we use towels for application because this is a very wet procedure, and these towels are all sterilized. This is very sterile mode, and so we move to the front. We're doing the anterior thighs now too. This is a full Monty. See all the holes? So we're halfway through this left anterior thigh here now. We're putting all this fluid in here that we're going to suck out later with the fat, and this makes it very comfortable.
Okay.
I like that we do it this way because I feel like the patients are coherent so they can kind of let us know how they feel, and people are often nervous about being put under.
Under local anesthesia, not general anesthesia, and that's why we put all the numbing in here. She's fully awake and aware, and this is what she gets to anesthetize. Side here, I'm going to put a little poke where I put some little local numbing in. Doing okay? Okay. As our patient plays Candy Crusher. What is that one called? Diamond something?
The one I was playing, Diamond.
What is this about?
No idea. Like, the song's always on, I feel like.
Time was singing that.
Oh.
He got upset.
Oh, okay. Okay.
Wait, so what does it
I
mean?
just doesn't know what it means. You
Tight. You're gonna feel like there's a beach ball between your legs because you're all numb and a lot of fluid in there. Yes, you can still move. She and I asked her if she says it all the time. I thought, and she does. Is that real?
Yeah.
So turn around and still sterile and do it. Make sure you look sterile.
Swerve.
Do our lipo part. We're ready to suck it all out, okay? I use a little baby punch. This is a 2 millimeter punch. Make a little hole. The lipo device, it vibrates. So by doing that, it will move the fat around quicker, shaking it up a little bit. There you go. The tubing, and then you can follow it all the way to the canister. We're starting to see it come out now. The patient can see it too. You doing all right?
Yeah.
Good. So the last time they got attention was from that. Yeah, from that. Crazy guy, right?
Well, yeah, I've been to the Davidian place.
Branch Davidian stuff.
Yeah, Branch Davidian.
Those are good. They're big. I don't know. I just like acres. I feel like it's more. I don't know. Homemade.
Oh, really?
Yeah, I like it.
On her side, so you can see her all the way up on that hip. I know it feels. There you go. Good girl. You okay? Is she too high up there?
Do you want this to go a little?
She looks a little high. She's a lot of.
Yeah, like oh snap. You know, like yeah, just the way that you use it. You know?
How dare you?
Yeah, kind of like you know like.
Do you know if she has any other experience other than the ER?
I have a resume.
Okay.
Valerie, for filming for us. We're all done here. You can see the fat. Yeah.
All right, that's it.